Welcome back to the Freedom from Diabetes channel, and I am Dr. Mayurika Dasbiswas. In our earlier sessions and earlier videos, we have talked about mental health extensively. We believe in having a total holistic transformation, not just healing for the mind, healing for the body, healing for the soul, and connecting you to the right expert, to the right professional is our responsibility. So here we have another great expert. We have heard him before speaking about depression. He is none other than Dr. Nilesh Shah sir from Mumbai. He's the head of the Department of Psychiatry in Sion Hospital. He's a legendary doctor, has done a lot of research, written a lot of research papers, trained many psychiatrists under him. So sir, welcome back. Today we are wanting to know about dementia. We're going to be asking you some questions on that. Thank you so much for giving us your time.
My pleasure.
Sir, please help us understand dementia better, because many people who are working or dealing with aging parents see that their parents are not as smart as they always used to be. Suddenly, there is a deterioration in their parents' way of thinking. They're not able to remember as well. They're not able to process as well. They repeat the same thing again and again and again and again. They have difficulty recalling names. So, and we very easily say that, okay, my parent is going through dementia and this is a part of old age. Nothing much can be done about it, but we don't really know what is dementia. So please help us understand what is dementia.
Yeah. So by and large, dementia is gradual decline in functions of brain, and particularly cognitive functions of the brain. So when I say cognitive functions, that means attention concentration, memory, visuospatial orientation, language, and executive functions. That is planning, organizing, prognosticating, etc., etc.
So what is prognosticating?
So for example, I have to go from here to Sion. So I plan, okay, tomorrow at 8 o'clock, I will start from here. And then by what time I would reach. So depending on the time of the day, if I am leaving early at 8 o'clock, I'll reach by 8:30. But if I am leaving at 9 o'clock, probably I'll reach by 10 because the traffic will be more. So prognosticating is that what will happen at different point in time. I can estimation. Right. So planning, organizing that if I'm leaving at this time, I will start at this time. But if I'm leaving at this time, I will start at this time. Say, for example, for women in the house, usually suppose you are 3 or 4 people in the house and you are cooking so much food. Now today there is 2 more people are coming as a guest. So now you will plan that, okay, today 2 more people are coming. So I will start preparing the food little early. I'll prepare 2 more items. The quantity of the item will be more, and how much they will eat probably. This item, mitha, probably they like more, so they will eat little mitha more. And this they are not very fond of, so I'll prepare. So all these are called executive functions. So what I said, cognitive functions: attention, concentration, memory, orientation, visuospatial. Should I go to left? Should I go to right? Should I go to front, behind? In my house, the toilet is on right side. The gallery window is on left side. When I have to go to Sion, first I have to go to right side, then catch the bus, and then bus will drop me here. Then I have to turn left. All this visuospatial orientation, which we require for traveling, from going from one place to another place. And then language. So you tend to forget certain words. Your language becomes very, very monotonous, and you are able to use only few words. Your vocabulary gets affected. You may not remember certain words, may not be able to pronounce certain words properly. And executive functions. So if there is a gradual decline in all these functions, then it is considered as dementia. One of the most common type, which we call dementia, is Alzheimer's dementia. Though there are other types of dementia, but usually by and large dementia means Alzheimer's dementia.
So that is the reason why they can get lost if they are alone by themselves outside.
Yeah.
That is the reason why sometimes it may happen that they are taking care of a young one, but if they're taking care of the young one outside the home, then it can be a little risky. Can I say that if they're having that gradual decline in their cognitive function, so if they're taking care of the young one outside the home, it can be a little risky. Any other common challenges that you notice that their family members may face?
As there is a cognitive decline, they also may develop certain behavioral and psychological symptoms of dementia. What is there is an acronym called BPSD, behavioral and psychological symptoms of dementia. So they may become very childish. One of our patient, she used to go to Juhu Beach with her granddaughter. And earlier, the granddaughter used to throw tantrums that she wants that candy floss and some toys, etc. And this time, the granddaughter brought her grandmother to us, saying that there is a remarkable change in her behavior. That when we go to Juhu Beach, instead of me asking for it, she is asking for candy floss and toys. And we feel surprised that this grandmother at the age of 80, why she is asking for candy floss. And we says, Dadima, aap to bacche nahi hai. No, I want, please, I want this, I want. And she wants toys and she wants to collect certain things. She used to behave like a children. Similarly, many of them keep the things somewhere and forget because they don't have good attention concentration. And they have kept place not at the regular place, and they keep it somewhere else, and then go and search for that item at their regular place, which is not there. They develop paranoia that somebody must have stolen it, somebody has taken it, somebody has hidden it,
right.
and they are doing
Doubting
it
the
purpose.
servants.
Yeah, doubting the
Having
servants.
difficulties with the servants then.
Yeah, and they think that purposely people are doing it. Actually, they have forgotten where they have kept it. And finally, they find it, but they feel that somebody must have purposely hidden this. And similarly, in very, very beginning, when they realize that they are forgetting things, some of them develop depression, that what is happening to me, why I am not remembering things, why I forget the way back home, why I have to ask people, why I have to take help of the people. So they can develop severe anxiety when they get lost, when they don't remember, when they make mistakes initial. And once they start forgetting very much, then they also forget that they are forgetting. So in that case, they don't even remember that they are forgetting.
Sometimes I've noticed family members believe that the elderly person is doing all of this on purpose. ये तो जानबूझ के ऐसा बच्चों जैसा बिहेव कर रहे हैं, ये जानबूझ के अपनी चीज किसी और को दे देते हैं, या ये जानबूझ के याद नहीं कर पाते, or they're not able to remember, because if they're not able to remember one thing, then they should not be able to remember other things also. But they remember items of their own interest, but they forget about responsibilities. So many times family members, I've seen them become a little confused that are they doing this on purpose, or is this an illness? What is it?
Yeah. See, this is what happens, that when at the beginning of the dementia, what they lose is a recent memory, day-to-day memory, episodic memory. So see, if I have taken breakfast in the morning, I don't have to make any effort to remember it. Automatically that event is registered in my mind. And in the evening, if somebody would ask me, what did you have for your breakfast? I just have to recall the morning events, what had happened and what was prepared. And then I say, yes, this was prepared, I ate this.
Correct.
Now, this automatic registration of memory does not occur in the beginning of the dementia. But if you ask them what happened 10 years back, they will remember it very well, because that memory has been stored long back and very well revised over a period of 10 years, because they have shared it with so many people. So that memory is very strong and hardwired. But this new memory is not even registered.
So the registration of new memory gets affected. I met you yesterday, that gets affected.
Yes.
But where I met you for the first time, I'll remember that.
Yes. So that's why there is a confusion. How come they remember things which has happened 10 years back? And now 10 minutes back, what has happened? They say, no, I don't remember. So there is a confusion. So I don't blame relatives for them because it really is confusing for everyone. But when you request the relatives to understand in this manner that this is an illness in which the first thing to go is the recent memory. And that recent memory is new memory forming or new learning. Whatever they have learned in the past, they can do it properly. If you ask them to roll chapatis, they'll be able to roll chapati. If you ask them to cut vegetables, they will be able to cut vegetables. But if you say, can learn to use mobile, new thing, or learn to operate a new gadget, like say microwave oven, they may not be able to learn that.
Because the registration of new memory is affected.
New learning is affected. And that's why sometimes this causes a confusion. I don't blame the relatives also, because if we were not psychiatrists or we did not have any knowledge about these kind of things, as a normal human being, lay person, we would have also thought like that.
That is so true. That is so true. So what can family members do to help such elderly people in the family?
Yes. So first and foremost is they must accept. Accepting this is very, very difficult. So accept that unfortunately or fortunately, this person has developed dementia. It's an illness. Everybody should tell themselves that this is an illness which every one of us are going to develop one day. We are all destined to develop dementia. It's like cataract. Some people develop cataract at the age of 40. Some people develop at 60. Some people develop at 80. So everybody, nobody can say कि मुझे cataract develop ही नहीं होगा. कभी ना कभी तो होगा ही, because there is a degenerative changes, and someday you will develop. So say 1 in 100 people will develop between 60 and 65, and 1 in 3 people will develop between 90 and 95.
Okay.
So everybody is going to develop dementia. So they should tell themselves कि see, आज इनको हुआ है, कल मुझे भी होने वाला है. आज मेरे parents को हुआ है, कल मुझे भी होने वाला है. So help their children to understand that this is what all of us are going to go through. Right. Today your grandparents are going through. Tomorrow I am going to go through it, and day after you also are going to go through it. So accept it
as a natural progression of life. Because I've seen people struggle with the acceptance that you are talking, they struggle with accepting the fact that my family member, my spouse is developing dementia faster or earlier than me. And they have to take care of such a family member, be it spouse, be it parent. And many times people like to give an umbrella term to all mental disorder, and that umbrella term is depression. I feel that becomes a challenge many times. If we call everything depression, then it may not go through the right channel of treatment. So that becomes a challenge, but acceptance is very important. It's going to happen to everyone. I think if we accept it also, we will stop pushing our elderly people to recover faster, because in depression we tend to tell people that chalo, come on, you have to recover out of it, you have to leave this sadness, I will support you, and you have to get better. But can that really happen in dementia? If we give them the right support, can they bounce back and become their original and old self back again?
Yeah. So first, as I said, acceptance. Second, telling oneself that I am also going to develop this kind of situation sometimes. So I should have more compassion for the person who has developed now. Third, they are not doing it purposely. ये नाटक नहीं कर रहे हैं, जानबूझ के नहीं कर रहे हैं. It's a state of mind. It is, their mind is not under their own control. Right. They are losing control over their mind. Fourth, majority of the patients with dementia develop behavioral and psychological symptoms of dementia, which are very, very challenging because they behave like children, and sometimes they lose temper, sometimes they become violent, sometimes they become aggressive, sometimes they wander away without telling anyone, sometimes they don't sleep at all for days together and keep every family member awake, sometimes they demand unusual things. So they have to be, though easily said than done, more patient with these people. If your child, 1-year-old child behaves like this, you will tolerate him because now he's going to grow out of it. But just imagine your parent, 80-year-old parent behaves like this, and you are, obviously it's difficult for you to kind of tolerate and live with this kind of situation.
And also painful to see them deteriorate like this.
Yeah. They might also become incontinent.
Yeah.
And they might pass urine and stool anytime, any place. And it might become very, very embarrassing situation. And sometimes help is available. Sometimes domestic help is not available. And sometimes the whole burden comes on daughter-in-law or somebody in the one person of the house, because other people are quite busy with themselves in their own work. So I think that everybody in the family should accept that one of our senior member has developed dementia. Unfortunately, Alzheimer's dementia, there is no treatment as such. It is a gradual decline of mental functions over a period of 8 to 10 years. Gradually, it is going to increase. Be prepared for it. Help that person as much as possible. And if possible, make remaining life of next 10 to 15 years as pleasurable, as pleasant as possible from their side.
Sir, I understand that you have also written research papers and you've conducted your own novel research on how we can deal with depression. Sir, I understand that you have conducted research on your own with your team and written research papers on dementia, something related to card playing. Sir, if you could kindly tell us about that.
Yeah. So one of the thing is that if you want to build up your muscles, what do you do? Exercise, muscle exercise.
Yeah, we recommend that a lot.
Yeah. So if you do go to the gym, or even at home, you can do muscle exercise, and strength of the muscle will increase. Yes. The power of the muscle will increase.
Yes.
Similarly, if you want to improve the functioning of your brain, what we call cognitive functions, then you have to do mental exercises. So now there are different types of mental exercises. So nowadays on mobile, various video games are available, which it will improve your attention, concentration, memory, speed, accuracy, planning, organizing, all kinds of things you can play on computer or mobile or video games.
Wow, so we can encourage our elderly to start playing games online.
Yes.
Excellent.
But the problem comes that there are a large number of population of India is in rural areas, where even simple electricity is not available. So many of them says कि हम लोग high-end mobile वो smartphone कहाँ से लाएंगे, and we don't know how to play. And now they have lost their ability to learn new things. Yeah. They can't afford these computers and video game portals and other things. So for them, what I recommend, the easy thing is to play cards. So I tell them, buy a deck of cards. If you go to buy a laptop or a phone, it will cost you 20,000 rupees at least. At least. A deck of cards will cost you 20 rupees. I have asked senior people, have you played cards? They say, yes, in childhood we have played. So there is a familiarity. See, mobile, computer is very unfamiliar with them. Playing card is socially acceptable. Cards can be played by one person also, and it can be played by group also. Right. And there can be various degree of exercise in card. You can have simple game like you can give him the deck of the card to your senior citizen and say, open one card. If it's a black card, put it on one side. If it's a red card, put it on the other side. So kind of, that is a cognitive exercise.
Right.
Similarly, colored cards on one side and picture cards on other side. So number cards on one side, picture cards on other side, or up to 7 on one side, more than 7 on other side. This kind of various exercises, or it can be made more and more complicated. Similarly, so like remembering the numbers. So you open 3 cards, show them, and ask them to remember these 3 cards. Turn them down and say, remember now what all these 3 cards are. So it's a memory game.
It's a memory game.
You can start with 1 card, 2 cards, 3 cards, and you can go on increasing the number of cards which they can remember. So you can improve attention, you can improve memory. Similarly, there are games like Rummy, where they require planning, organizing, and there are games like Patience, Judgment, where you have to, when you get the cards, you have to, at the beginning of the game, predict that how many hands you will be able to make.
Right.
And if you turn right, you get that many points. So all these exercises, which we do otherwise on computer or this mobile games, same kind of exercise, you can do it with card. Right. And if any of them have BPSD, behavioral and psychological symptoms, in a rage of anger, they can throw a mobile phone or break a computer. They can't do anything with the cards. Even if they throw the cards, it will not break.
Right.
Worst comes to worst, they can tear off the card. Nothing lost. You can buy another set of cards.
Right. That's so interesting. I mean, the solution can be so simple, and this research work that you have done on proving that the solution can be so simple is marvelous, and especially depending on the old memory, because cards are something that we have all played in our childhood and we all remember that, and we don't have to learn anything new over here. This is a brilliant and excellent example. I'm sure everyone who's watching this will encourage themselves and their elderly in the house to start playing cards and Ludo and whatever is possible. It'll be a great exercise for the entire family, bringing in more family bonding. The young people in the family can be encouraged to play cards with their grandparents, and that would be a great bonding exercise. I never thought that our discussion will lead to such turns of touching upon such delicate human issues and how bonding can happen even over a unfortunate event. An unfortunate event can also lead to great family bonding. So thank you so much, sir. You have explained this so simply. Thank you so very much. You gave some very good solutions and strategies to deal with dementia. To everybody, I would request you, if you still have questions, please post your questions in the chat box. Please post your questions in the comment section. We will be happy to answer your questions. We'll get the right expert for you again and again on these MedEx videos that we have on the channel. So subscribe to the channel if you've liked it. Give it a like button and share it with your friends. Thank you so much for your valuable time. This is Dr. Mayurika Biswas thanking you. Have a great day ahead.